Dawn, what do you think about the National Council's guidelines regarding the use of long-acting injectables?
Well, I think the National Council guidelines would make Henry a lot happier. The National Council is a group of mental health organizations, community mental health centers, and that's who represents the frontline people who are dealing with schizophrenia every day. And their guidelines are use it often, use it fast, offer it to anybody. So with first episode, they recommend it. They recommend it, for anybody who is not doing that well. They recommend it for substance use. So they're generally saying this is a first line treatment that we really want to recommend to our patients. And I just wanted to respond a little bit to what Henry said about being paternalistic. There is a way to offer long-acting injection to people in a shared decision-making framework that doesn't make you paternalistic. That if you present the information to them, to their families, and if you work with them, they can start to realize that this is the foundation of their recovery. If you tie it to their recovery goal and what they want to be and what they want to do, it makes it much easier for them to accept. And I think the National Council's guidelines are much more centered around how do you use LAI to help people recover, and that you need to use it much more often and offer it to anybody with schizophrenia who comes through your door. If you're going to offer an antipsychotic, you might as well, as John said, offer a long acting. And I think the National Council's guidelines do that.
And I'll just add to that and echo everything you've said. And I want to make a brief comment on this idea of clinician ignorance, which I think is really one of the driving forces. And I think it is people who were trained in a particular model and then have had difficulty adjusting to our new model and the new evidence that we've had. I can think of so many clinicians that I've talked to who believe that they are not going to be able to successfully offer a long acting to a patient. So they'll tell me, I don't really offer it to my patients because I don't think they're going to want it. And to me, that is just striking, because we now actually have evidence suggesting that that is not at all correct, that if you offer it in a collaborative fashion like Dawn is talking about, that most patients actually would consider it, and many of them will actually take it. And so we know that these clinicians are wrong about what they're suspecting. And one big question is kind of how to move them in the direction of actually just listening to their patients. And I remember one in particular who I just said, why don't you just try it? Right? So I know you think your patient's going to say no, but how about the next time you see a patient with schizophrenia, or the next 10 times? Just go ahead and offer it and see what happens. And I remember following up with him, I think about a year later, and he said he'd completely changed around his practice, because even though he didn't believe it was going to work, he started offering LAIs to all of his patients in kind of a positive way, and was completely shocked when the majority of them accepted the LAI from him. And he did not think that that was going to happen.
And I would add to that I believe that as providers, we have a duty to let our patients know what their options are. They don't know, and it's not their responsibility to know. It's our responsibility to know, and it is our job to educate them on what their choices are and to help them make a choice with us, offering some guidance that is going to be in their best interest, taking all things into consideration.